All right. Hi, my name is Rachel Skaffert, and I am doing my presentation on bipolar II disorder. All right, before I dive too far into treatment types, I did want to give a little brief difference of what bipolar I and bipolar II look like. So I included a graph below so you could kind of see the flow of things and see how the depression and the mania and the hypomania are different. The depression in bipolar II tends to be more severe and typically doesn't involve a loss of reality. So in my research, I found there's a lot of challenges in treating bipolar II. One of the biggest is that those with bipolar II spend approximately half of their life with depressive symptoms. And so it's really difficult to find one medication that manages that and the hypomania. Another challenge of treating it is that it's also commonly misdiagnosed as bipolar I, or it just often goes undiagnosed. And there's just a lot of uncertainty around diagnosing it in general that really does extend into treatment. A lot of the treatments that I found research on were considered to be really controversial. And there's less treatments reviewed of psychotherapy approaches and more on medicine. So it's just in general really difficult to treat because of how intricate it is, and it does tend to vary a lot between person to person. Some people even think that it has subtypes or different atypical features within each case. But overall, there's just very little studies that have been done on the treatment of bipolar II, despite it being pretty common. So I just wanted to give all that information going into this because it definitely affects the amount of information I was able to find on treatments available for bipolar II. All right, so kind of overlooking the current treatment that is available. As I said, most methods do center around medication, which is kind of controversial, just because there's not many other ways that are working at this time, and medication is unfortunately trial and error in a lot of ways. But yeah, the earlier the onset of it, the better the treatment can be. And as a whole, bipolar II does have like long-term lower cognitive performance than patients with bipolar I, and so that also affects the type of treatment that's available. A survey with over 9,000 subjects thought that only 16% of patients with bipolar II received the appropriate medication that they needed. There's a kind of a risk to benefit of antidepressants in bipolar II that remains unresolved. So essentially what that means is that the antidepressants kind of help with the depression, but they don't really help with the mood stabilizers. But they did find that a diagnosis, which eventually helps for treatment, does seem more reliable when it's done with some sort of structure and assessment interview. And so if that's done well, treatment plans tend to be a little bit more clear. So kind of looking again a little more in depth at the medicine that is available. So most studies that I found on treatments focused on lithium, which is typically used in bipolar I disorder. And overall, the consensus is it hasn't been found to be effective or ineffective for people experiencing bipolar II. But it doesn't necessarily hit on that depressive state that is really common and can be really prolonged for people with bipolar II. Some studies I found showed that there was a 60% response rate for people with certain medications for 9 weeks, but traditional medication really does little to address the hypomanic episodes of bipolar II, which are different than the manic episodes of bipolar I, and so a little more difficult to know how to treat. Another downfall, too, in treatment so far is that most of the studies on treatments have been done in a controlled setting, and so they've never really done a lot of studies that include less controlled environments. So kind of looking at the differences between different treatments. There was a lot of studies done on monotherapy for this to see if one, medication or therapy worked best for this. And it was just kind of both, depending on the study, but I did show 2 different studies that I looked at. In one study, 9 out of 17 patients saw results from a monotherapeutic approach, so without medication, which is like over 50% success rate, which is great. And then a study with just medication only for bipolar II patients saw that 3 out of 11 individuals on, I'm not going to try to say that medication, I don't know how to say it, but they saw a reduction of their depressive symptoms. So less successful with a 27% success rate. But again, these are just 2 studies that I found. There's not a lot out there, but I thought this would be a helpful visual for you guys. I skipped that. So incorporating spirituality. I just put a picture because I couldn't find much about research and incorporating this. But I think this takes a lot of prayer and patience, as they don't really know what the best treatment is for bipolar II. And it's different enough than depression, and it's different enough than bipolar I, that it can make it a really difficult and frustrating process. And so as I was reading over all the treatments that is available and the critiques of the treatment, I just felt really, like hopeless in a way for those who don't have Christ, to look for guidance and kind of grounding in this process of trying to find appropriate treatments. So I wanted to add that for you all. So kind of drawing on the conclusions. So again, there's really not a lot of actual evidence-based research available, so it's hard to have actual conclusions that can be drawn. In other words, essentially nothing is definitely known when it comes to the treatments and their successes in bipolar II, which is really frustrating. But that's where they're at right now. And another consensus that's been kind of made too as a result of a lot of the studies that I did get to look into in depth, is that each case of bipolar II seems really unique, and the forms of treatment really seem to matter depending on the person. And so I'll kind of get to this later on the page, but it just seems a lot of individualistic factors play into treating this. And again, more studies, CBT and bipolar need to be conducted to see the connections that plays with the cognitive stuff, as I did find in some research that long-term effects of bipolar II can cause greater cognitive delays than in bipolar I. And another study did suggest that interpersonal and social rhythm therapy would be a good intervention style for patients. Again, there wasn't much on that, but that was just what they theorized after a study. So again, I said more studies need to be done to show that support. And characteristic factors of each individual seem to play, again, kind of what I was talking about earlier, a really large role. But again, that needs to be studied more thoroughly. However, the problem with that is that it's just really, it's kind of hard to study and ambiguous to measure characteristics. So even though this is a really common thing, it feels like there's a long ways to go and a lot of ways to get to results that work for people. So here are my references, and thank you for listening to my presentation. I hope you found it informative, and I hope that maybe you'll be one of those people who makes a difference in researching more about effective treatment plans for people who are experiencing bipolar II, because at this time there's just not a lot out there and not a lot of research that's available. But I feel hopeful that people are passionate and wanting to treat people well who are struggling with this. So thank you for listening to my presentation.